that occurred in America every single day because of opioid-related overdoses, and companies that are responsible for the roughly 9 deaths that occur in New York State alone every single day because of opioid-related overdoses, and resulted in more than 3,200 deaths in the United States. After a multi-year, multi-industry investigation conducted by this office, this lawsuit contains 4 main sets of allegations. First, this lawsuit alleges that through years of false and deceptive marketing, the following manufacturers of opioids, Purdue, Janssen, Mallinckrodt, Endo, Deva, and Allergan, have grossly misled the public about the true risks and dangers associated with opioids. Second, what is more groundbreaking about this lawsuit are the allegations against the distributors of opioid drugs. McKesson, Cardinal, AmerisourceBergen, and Rochester, some of the biggest distributors of opioids in New York and in the nation. They failed to exercise their most basic duty to detect and report the diversion of opioids because of poorly designed, poorly resourced, and poorly executed monitoring programs. Third, this lawsuit contains detailed allegations about the Sackler family and their attempts to hide the vast fortunes they collected at the expense of actual lives. In an attempt to shield these fortunes from families whose loved ones have been killed by their products, we allege that the family has illicitly transferred funds from Purdue to personal trust so that they are potentially outside of the reach of law enforcement and our efforts to seek restitution or penalties. Fourth and lastly, the lawsuit sets forth detailed False Claims Act allegations against all of the defendants based on opioid prescriptions that were paid under state health programs because of the defendants' misconduct. The gross misconduct exhibited by these defendants enabled countless New Yorkers to obtain prescriptions that were not medically necessary, prescriptions that New York State taxpayers footed the bill for because they were paid under state health programs, including but not limited to Medicaid. This is an extensive lawsuit that leaves no stone unturned. You each have an executive summary of the complaint, and if you do not, we will provide one to you. And the full complaint is available to you online. But I want to focus today on a few of the aspects that are particularly noteworthy. This lawsuit breaks new ground by setting forth an exhaustive set of facts and examples alleging distributor misconduct. The opioid epidemic is especially destructive to New York because of the fraud, the willful misconduct, and the gross negligence of distributors who buy controlled substances in bulk from manufacturers and sell to individual pharmacy and other licensed dispensers. In New York, all distributors of controlled substances, including opioids, are subject to the New York Controlled Substance Act, which requires that they implement effective measures to detect suspicious orders, prevent the diversion of controlled substances into unauthorized hands, and report suspicious orders from pharmacies to the State Department of Health. This means that distributors must have robust internal compliance systems. Yet the named defendants in our complaint knowingly had insufficient systems to detect, prevent, and report suspicious orders. The 4 distributors not only lack sufficient compliance functionalities, but actually incentivized sales representatives to sell as much product as possible. And in the cases when a suspicious opioid order was flagged, investigations were not conducted, the orders were not blocked, and they were not reported to the state. Simply put, they put profit over patients. These distributors continued to sell opioids to pharmacies even after numerous red flags should have triggered them to stop. It is these systematic failures by the distributors that led to massive shipments of opioids to pharmacies in New York that filled prescriptions written by doctors who have been charged with or who have been convicted of illegal prescribing. All four distributors, McKesson, Cardinal Health, Amerisource Bergen, and Rochester, failed to act to suspend customers from ordering controlled substances. And what's worse, they failed to terminate the accounts of these pharmacies, even after compliance staff blocked and reported many suspicious orders from those customers. Let me give you a specific example of how this played out. Cardinal Health has been the leading distributor of opioid drugs in New York since 2010, having distributed over, are you ready, 780 million oxycodone pills to pharmacies in New York, including many suspicious orders. One particular pharmacy in Suffolk County, we'll call it Pharmacy A, had the highest volume of opioid orders in Suffolk County and amongst the highest in the state. The incredibly high volume of opioid orders is a red flag. And in fact, Cardinal reported the suspicious orders to the DEA and the Department of Health. They reported an average of 85 suspicious orders per year for 5 years. Yet, despite reporting the suspicious orders, Cardinal continued to fill the orders, and some as recent as 2018, at another pharmacy that Cardinal supplied on Staten Island. 60% of the opioid prescriptions dispensed in 2016 and 2017 were written by doctors who were later indicted or convicted. And 60% of the prescriptions were paid for in cash. A clear red flag for potential diversion. Yet Cardinal has yet to issue a single suspicious order report related to this pharmacy on Staten Island. McKesson has been the second leading distributor of opioids in New York State over the past decade. Ready? Dumping more than 540 million oxycodone pills into pharmacies since 2010. Between 2010 and 2013, McKesson shipped opioids to 145 pharmacies that exceeded their monthly threshold for opioid orders at least 12 times in a year. But yet McKesson did not report not one single suspicious order. These are just a few examples of the reality that has existed throughout the state for far too long. And distributors more interested in their bottom line, and their profit margin, than the health and safety of New Yorkers. This widespread failure by distributors, coupled with manufacturers that continued to push deceptive statements masking the true dangers and risk associated with their products, resulted in an exponential increase in the number of prescriptions written by doctors for these drugs over the past 20 years. And it has become quite clear that many of these prescriptions were not medically necessary, yet the state was duped into covering them anyway under various health programs. But let us not forget the masterminds, the family enterprise behind this crisis. The family that literally profited off of the suffering and the death of countless New Yorkers. The Sackler family, the owners of Purdue. They're estimated to be worth several $billion. Billion. And as Purdue sold more and more opioids, the Sackler family transferred more and more and more wealth to their personal accounts. And as the lawsuits have piled up against the Sackler family and Purdue for their roles in this crisis, they continue to move funds into trust and, yes, offshore accounts to be out of the reach of any potential recovery or out of the reach of the long arm of government and law enforcement. And so for the first time, our lawsuit includes fraudulent conveyance claims against Purdue and the Sackler family. And as we mentioned, or as I mentioned at the outset of this press conference, 9 deaths occur every day in our great state. And while there's no way we can bring back those we've lost, this office is filing this lawsuit to seek a meaningful remedy for the challenges that these families in our state face with this epidemic. And specifically, we're looking for substantial payments for the defendants to fund an abatement program that will provide treatment to New Yorkers suffering from opioid use disorder and enable all corners of the state to step up their efforts aimed at prevention and education. We are also seeking penalties and the disgorgement of wrongfully obtained profits, both as punishment for the terrible wrongs already committed, but also to deter these companies and any others from ever taking advantage of New Yorkers this way again. Beyond these remedies, however, our lawsuit advances a simple but powerful idea that has real and lasting teeth. To the manufacturers and distributors addressed in our lawsuit, we say simply, your license to produce, to market, and to distribute these drugs is a privilege and not a right. It's a privilege contingent upon your compliance with the law, your obligation not to promote these products deceptively, and your obligation to implement genuinely effective suspicious order monitoring and anti-diversion systems. If you do not get into compliance with the law, we have outlined in myriad ways in this lawsuit that we will not allow you to continue selling controlled substances in New York. Full stop, period. When I ran for Attorney General, I made a commitment to New Yorkers that I would tackle the crisis and take on these responsibilities for its destruction. During my campaign all across the state, I've held in my arms too many mothers, too many fathers, too many individuals who told me stories about how their children died and how they died because of this epidemic that could have been prevented. And so today, to all those who I met, I'm fulfilling that commitment. And I'm very proud to say that the entirety of this multi-year investigation and lawsuit was conducted by the great and fine lawyers and analysts within this office, the Office of Attorney General. An amazing team. We know that taking on Big Pharma is no small task, and you need the best and the brightest to step up to the plate. And we have committed the resources to ensure we can do that because it is a top priority. And I want to extend my heartfelt thank you to all of those individuals in this office who have spent countless hours, who've done it with selfless dedication. And we know that we would not be here today but for their commitment. I particularly want to give a shout out to David Nachman. Where's David? Okay. He's our counsel for opioids and impact litigation, and he supervised and spearheaded this work. Where's Lisa Landau? Lisa is the chief of our healthcare bureau. And then the army of lawyers. I know they're around here somewhere. John Oleski, Chris Luong, Sarah Mark, Elizabeth Chesler, Connor Duffy, Carol Hunt, Diane Johnston, Larry Reyna, Michael Reisman, Jennifer Simkovich, Paulina Stamatelos, legal assistant David Payne, Corey Nugent, and our invaluable research staff under the leadership of our Director of Research, Jonathan, where are you? Jonathan, there we go, Jonathan Werberg, and Deputy Director Megan Torsfelt. Megan, where are you? I apologize if I mispronounced your name. Katie Rossman, Gutman Sisodiha. I hope I pronounced that correctly, and if I did, I apologize. Anusha Chowdhury. I want to thank each and every one of them. They worked long hours. This office exists to protect New Yorkers from any and all forces that would try to hurt us. And we won't stop until our state is free from the toxic grasp of this crisis, which has befallen so many New Yorkers. There are so many New Yorkers whose lives have been destroyed by this epidemic. And today I'm thinking about all those families that will never be whole again. For everyone who lost their life, for every parent who will never hold their child again, for every community that's been devastated. Today we take a stand. Today we say enough. Today, my friends, we turn the tide. And now I want to call our first speaker, Justin St. George. Before Justin begins, I want to thank him. You know, Justin was telling the staff and talking to me earlier how he was very nervous. But I want to thank him for his courage. He's a profile in courage. Justin is someone who's been personally impacted by this crisis. But he survived. And he will speak to the challenges that he has faced. We're very proud of Justin. Not only is he in recovery, he works at the drug treatment facility on Staten Island that helped him, providing counseling and care for our youth. And so I personally want to thank Justin for sharing his story and for all that he has done to help our community. Justin.
Thank you. Good morning, everybody. See, as the Attorney General said, I'm a little nervous. No, for the first time for all cameras and everything. But so my name's Justin St. George. I'm 41 years old, and I'm currently in recovery from an opioid addiction. You know, when I was first presented with this opportunity, you know, I was like, no way, I'm not going to share my story in front of all these people, you know. But this is something that's touched me personally and professionally. You know, I got involved with the drug culture early on, you know, when I was in my teens, I guess you'd say. And, you know, I made some mistakes. I got my life together. I became a social worker, had a slip more in the recent years. And so, you know, for half of my life, I was affected by this epidemic. I was caught up in it, I would say, in probably in the beginning of it, you know, when I was prescribed Vicodins or something from the dentist, you know, and then just looking around, going to doctors and, you know, friends of mine that would get prescriptions for any type of, you know, they could have a headache and doctors would just, you know, give them, here, take this, and you know, they would spark this path of destruction that I went on as well. So I didn't know where that would lead me, but ultimately I knew I needed to get help, and it took me to a place, Camelot of Staten Island, you know, and there I was able to get clean, turn my life back around, and continue my career as a social worker. You know, they gave me an opportunity to start, you know, from the ground up, one of their new programs, this youth clubhouse. It's a prevention program for kids, after-school program. So, you know, I was blessed with that opportunity, you know, and I'm now able to give back and continue filling my purpose that I've learned that I had, you know. But as far as this, you know, when I heard, you know, the pharmaceutical companies, I've been saying this for years, you know, I can't, you know, I couldn't believe how readily available just pharmaceutical drugs were. And, you know, it's, I mean, anyway, you know, you think of a doctor prescribing you something, you're like, so, you know, it's from a doctor, it's okay, you know. I mean, I've had friends, myself, I mean, you know, you could go to, you know, doctor shopping, you know, walking into a doctor's office and paying cash for pills. It's like, you know, I mean, we hold accountable drug dealers, drug traffickers, you know, but the pharmaceutical companies hide behind this legitimate enterprise, and as far as I'm concerned, is just as guilty as a trafficker or a drug cartel or whatever. So I appreciate the Attorney General, taking this on and attacking this issue. It's definitely a serious public health issue that, there's a stigma attached to it too. So I know it's been, there hasn't been a lot of positive light on it. And so I appreciate, being able to come up here and share my personal experience with you guys. And, I could say over the years, these companies are responsible for perpetuating the drug culture, and creating addicts, so thank you.
Thank you, Justin.
Thanks.
Thank you, Justin. Next, I want to introduce Dr. Joshua Lee, who is an associate professor of population health and medicine and general internal medicine and clinical innovation at the NYU School of Medicine, where he also serves as a director of the NYU Fellowship in Addiction Medicine. His research focuses on addiction pharmacotherapies. And so now I'd like to call to the podium Dr. Lee.
Thank you, Attorney General. It's widely recognized that in today, 2019, illicit fentanyl and like analogs are accelerating overdose deaths more than any other type of opioids. Yet prescription opioid products continue to provide a steady floor to the epidemic and are linked to roughly 1/4 of all overdose deaths in 2017, according to CDC data. While pain and suffering are a universal human experience, the United States remains a global outlier in terms of the amounts and rates of prescription opiate use, a market that steadily expanded beginning in the 1990s. No other developed country or economy comes close in terms of the amounts of prescription opioids sitting in America's medicine cabinets, and no other country has seen as much harm and preventable death as a result. All of us in healthcare bear responsibility. We all must accept the challenge to lower population-wide risks associated with opioids. This means prescribing medication responsibly and looking at ways to use other medications for treatment of opiate use disorders. It also means humanely and effectively continuing to manage the pain and opiate medications of chronic pain patients who now find themselves sandwiched between yesterday's overprescribing trends and today's newer standards pushing for much less use. Any of us will become tolerant and increasingly physically dependent on any type of opioid if taken regularly. This can happen in a few weeks, or in some cases after just a few days of steady use. This is a well-known principle of opioids and human neurobiology that has been understood since the 70s and arguably much earlier in terms of centuries of experience with opium and then morphine. Many of us, in a much greater proportion than ever predicted or claimed by these manufacturers, will transition to chronic dependence on opiate medications. Even worse, many will then develop a severe opiate use disorder, aka opiate addiction, even following brief exposures to prescription opioids. This means taking the medications at higher than the prescribed amounts, combining them with other drugs and alcohol, and sourcing them ultimately from dealers and friends. The stories and anecdotes of young adults developing opiate addiction after wisdom teeth extractions or sports injuries are seemingly countless and have by now affected so many families, schools, and communities. The widespread and routine use, mainly of oxycodone and hydrocodone products, directly set the table for the current heroin and fentanyl epidemics. Illegal opioids, which are now widely available in nearly every county and corner of New York State, own medications, as well as counseling. We all must continue to advocate and demand wide and expanded access to these medications in opiate treatment programs, other specialty addiction treatment centers, and in general medical settings, including primary care, where I work. The State Attorney General's Office has now for years aggressively enforced mental health and addiction parity standards, as well as New York State-specific opiate reforms, which call for easy access to these treatments with as few insurance barriers as possible. This has been particularly important to Medicaid patient populations who often lack the resources and power to otherwise fight for these treatments on their own. Thank you very much.
Thank you, Dr. Lee. And our last speaker is Gary Buchin, who is the executive director of Bridge Back to Life Center, one of New York's premier chemical dependency treatment institutions. He has led Bridge Back to Life for nearly 20 years and has advanced training and degrees in addiction counseling. He's also a founding board member and past president of the Board for the Addiction Treatment Providers Association of New York State. Mr. Buchan.
Thank you, Attorney General. Good morning, everyone. I'm honored to stand here today with the Attorney General representing the treatment community's perspective on the opioid epidemic. We applaud the actions taken here today and hope that more New Yorkers will be beginning to take advantage of the resources that are available here in New York State. We've seen firsthand the devastating effects that active addiction has taken on too many families throughout the state. Too many of our children, too many of our friends, and too many of our loved ones have fallen victim to the epidemic. We have attended more funerals than we care to count, and we now spend more time comforting the families of lost ones as we do in actual treatment of people who found their way into our treatment centers. The stereotypes that have long plagued those suffering from addiction have been obliterated. Addiction to painkillers has no race, no age, no gender biases. It is not only the destitute and the homeless that suffer. We have successfully treated the scholar athlete, the stay-at-home parent, the high-level executive, the sports star, the TV personality, those who wear blue collars and those who wear white collars, and even those in the medical profession themselves that have fallen victim to prescription opioid addiction. The good news is that recovery is possible, as we've heard. With the past support of the Attorney General's office and the legislature, passage of several bills aimed at both improving access to care and specifically targeting lengths of stay for those dealing with opioid addiction, more people are entering treatment now than ever before. More lives are being saved. Whether it be inpatient detox or outpatient treatment, there's no one path to recovery. Residential treatment, sober living environments, methadone-assisted treatment, medication-assisted treatments, opioid treatment programs, and others are just some of the available resources right here in New York State. Everyone can find their own program. Everyone can find their own individual recovery if they come out of the shadows of grief and shame and understand that addiction is a treatable disease of the brain. We encourage anyone and any family that needs assistance in treating their opioid addiction to find the help that best suits their needs. Thank you.
And now, any questions? Yes.
What day was the amended complaint filed and why in Suffolk County?
So it was filed in Suffolk County because that's one of the areas that has been targeted. But the reality is every corner of New York State has been affected by this opioid crisis. And it's really critically important